Hi, everyone, and good afternoon to the Emory 60 Plus community. Thank you for joining us today for an insightful webinar about Medicare. My name is Gloria Grievous, and I'm with the Emory Alumni Association, and I serve as the staff liaison for the Global 60 Plus Network. It's a pleasure to work with you all, and actually, I enjoy the programming as much as you do, so we're looking forward to a great session today. Before we start, I'd just like to set the stage for our time together. Our expert speaker, who I will introduce in a moment, will share an educational presentation on the complexities of Medicare with the goal of helping you understand your current options and make informed decisions. But it is important to remember that no one has a crystal ball when it comes to future policy changes. Our speaker will share information based on current regulations and trends, but cannot predict what the current or future administrations may decide regarding Medicare policies. So with that said, it is my great pleasure to introduce Jonathan Lowenberg, one of our very own Emory Business School alumni. He had also his MBA from NYU. Jonathan is the CEO of Wise Wellness. It's a company that helps educate consumers to give them greater knowledge about their health insurance options, especially those who are making Medicare decisions. He is passionate about guiding people to find the best health insurance options for them, and some of that is based on his own personal experience. He faced a major healthcare setback 12 years ago, and he was fortunate to have the right insurance, but far too many are not so lucky. And for sometimes it's for no other reason that they just don't understand the available options. Jonathan has worked within the healthcare and wellness space for over 25 years. He's a former investment banker specializing in the biotech and healthcare industries. When he's not serving clients, Jonathan is passionate about his daily yoga and wellness routine, his walks in Central Park, and bike rides down the Hudson River. Pat, that sounds wonderful. So we'll let Jonathan get started. We're going to hold questions until after his presentation, but you can put those in the chat. And we did get a lot of questions via the registration form, so we'll focus on those first. Jonathan, the floor is yours.
Hello, everyone from Emory. I am thrilled to be doing this webinar today. First, I'd like to thank Gloria, Jen, and Ginger, as I told them the three Gs prior to starting this. I'd like to let everybody know first off that we will go through the presentation. It is not Wonderful Wednesday like we all had back in the days of Emory where there's no class. Today you have class. Today's class, I will be the professor, is a mandatory class, and it's Medicare 101. Okay, everyone has to take it because we're all going to be going into Medicare at some point. So I'd like to start by telling you that I am the CEO of Wise Wellness. I'm an independent agent. What does that mean? An independent agent works with many carriers as opposed to a captive agent that works for a carrier. When you work with an independent agent, whether it's me or someone else, the rate is exactly the same for the plan and structure that you purchase. We get paid by the insurance company. So it's wonderful to be able to work with someone who can guide you at no cost. What we do is find the best structure for you and the best plan for you. And after you've entered Medicare, we follow up with you every year during annual enrollment period. When things change, your situation can change or the plan may change. So it's important to have someone by your side as you enter Medicare and as you go forward for the rest of your life. Now, there's a lot of letters in Medicare, A, B, C, and D. We're going to start with A. Part A is known as hospital coverage. There is no premium for most people. The reason why I say no premium for most people is the rule is if you've worked 40 quarters throughout your life, you or your spouse, which is 10 years, you can borrow their years of work. Part A is free. If you or your spouse have not worked 10 years, i.e. less than 10 years, you will be charged for Part A. Majority of people, obviously, on this call will not be paying for Part A. Covers inpatient hospital, skilled nursing, inpatient rehab. The deductible for Part A this year is $1,676. That's per benefit period. What does that mean? That means if you go into the hospital for 3 days, after 60 days, the clock starts again. That 1676 deductible starts again. So it's a per benefit period. Remember that because we're going to look to cover that in the gap. Part B Part B is anything outside the bricks and mortar of a hospital, i.e., physician services, outpatient hospital, certain home health care services, durable medical equipment, anything outside the structure of the hospital. The Part B premium in 2025 is $185 a month. We'll talk about that goes up if you have an income-related monthly adjustment, which we'll discuss. The Part B deductible is $257. That's very different than the Part A deductible because that's an annual deductible. Once you meet that $257, then your coinsurance kicks in, which is 20% of all of your bills. Medicare covers 80, you cover 20. So there's an issue there as well, which we'll talk about in the gap. Okay, that's A and B. Now, when should you enroll in A and B? You're eligible and effective for Medicare the first of the month of your birthday, 65th birthday. So let's say you're a January baby like myself. You'll have 3 months prior to your birthday to enroll. That means my effective date is January 1. My eligible date to enroll is October 1st. You also have the month of your birthday to enroll, and you have 3 months after your birthday to enroll. So it's a 7-month window. My advice, and everybody on this call should do this because you're being educated, is to enroll 3 months prior to your birthday. We send out a text message and email to remind you about that and a link to enroll. It's always important to go earlier than later because your Part B effective could start after your birthday month if you enroll on the back end of that 7-month period. If your birthday falls on the 1st, you're effective the month before. So if you're a January 1st baby, your effective date is December 1, and then you create the clock back to create those 7 months based on the month before your birthday. That's only if you're a January 1st baby. If you're collecting Social Security before you enter Medicare, you will be auto-enrolled. You don't have to do anything. And the Part B premium of $185 or more will be taken out of your Social Security check automatically. If you're not taking Social Security, you'll do what's called the manual enrollment. Now, the easiest way to enroll for Medicare is online. Okay, my suggestion after this call, if you haven't already, is to set up mysocialsecurity.gov. It's your dashboard. That dashboard will show you all your Social Security payments that you can ultimately receive, you will be receiving, but it's also the dashboard that you'll be enrolling in Medicare. So set that up if you haven't already. That's where you'll be enrolling in Medicare. The second option for you is to call Social Security or try to make an appointment in the Social Security office. I will tell you, getting a hold of a Social Security agent today is extremely difficult. It takes a very long time on hold. And now you need to make an appointment to go to the Social Security office. You can't just stop in. So I believe making your enrollment online is the most efficient and effective way for enrolling in A and B. Since you're not collecting Social Security and you're enrolling automatically, you'll be getting a bill for that $185 quarterly. You also can set that up through auto pay, i.e. a bank pay. Now, if you're working, some people do not have to enroll in Part B. Okay, it's called a waiver for Part B. I do recommend always enrolling in Part A if you're working. Since you're eligible and it costs zero most of the time, you should enroll in Part A when you turn 65. B, though, if you're working, you have rules here. The rules are very simple. If you or your spouse is working and the company is greater than 20 employees and you're on the company coverage, you have a valid waiver for Part B. Okay, it's got to hit all those rules. One of you is working, one of you is on that, both of you are on that group plan, and it's 20 or greater employees, then you have a valid waiver for Part B. Okay, if you're working and the company is less than 20 employees, let's say it's 19 employees, you need to enroll in Part A and B. Medicare becomes primary. COBRA is not a valid waiver for Part B. Okay. Now, I'm going to cover a few things as I call them negative stuff. The negative stuff is, first off, if you don't enroll in Part B when you're supposed to, then you'll have a valid waiver of 10% penalty for Part B. Income-related monthly adjustment. This is an important one. Right now, if you're single and you're making less than $106,000 and a couple making less than $212,000, you'll pay the $185 per month that I talked about. If you've made more, and it's a 2-year look back, they look at your adjusted gross income from 2 years ago. So if you're entering Medicare in 2025, they're going to look at your 2023 adjusted gross income. If you made more than that number, there's a grid. It goes all the way up to $500,000 for an individual and $750,000 for a couple. That Part B payment could be $628 per month. And you also get a Part D, which is your drug plan, IRMA, and that's $85 a month. So the point here is that the $185 per month only is for those making less than the first threshold. All right. And then there's a grid getting up to the 500 where you'll pay more each grid factor for Part B and Part D. Now, let's assume you're making $400,000 2 years ago in 23, and now you're only making, say, $100,000 because you've retired or you're working less. You can appeal that immediately. We provide you a link for appealing your IRMA. You do not have to wait for a 2-year catch-up. Okay, it's very important. I have a lot of clients of mine that made a lot of money 2 years ago. They've semi-retired and they don't want to have to pay what their tax return is showing from 2023. Appeal the IRMA and it will be reduced. Okay, a few more negative things and then we'll get to some positives. If you did not enroll in Part D, which is the prescription drug plan, when you're first eligible for Medicare, you will pay a 1% per month penalty based on the national benchmark premium today, which is $36.78. Doesn't sound like a lot, but 36 cents every month times the amount of months that you were not enrolled in Part D adds up. So you must have a prescription drug plan when you enroll in Medicare Part A and B. COBRA, in this sense, is a waiver for Part D. You will pay the penalty if you didn't have it. You'll pay the penalty when you do ultimately enroll in Part D. Okay, now we're going to get into why I'm here and why most of you are here. What do we do about covering the gap? It's very easy to enroll in Part A and B and decide whether you're eligible for B or not. But the hard part now is, what do we do about a couple of things? First off, original Medicare A and B does not give you prescription drug coverage. So we need to settle and figure out how to buy a prescription drug plan. Then we also have to figure out how to cover that 20% that's not covered by Part B. Remember, I talked about Part B after the $257 deductible. You're responsible for 20% of all the bills. Original Medicare covers 80%. We've got to figure out how to cover that 20%. And the last thing is we've got to figure out how to covering that $1,657 deductible from Part A that revolves every 60 days. Okay, so we've got what we call gaps in the coverage. There are two options in Medicare to cover the gap. Option one is to stay on original Medicare and buy a supplement, also known as Medigap plan. If you go with that route, you'll be buying a separate prescription drug plan or Part D, or known as a standalone PDP. Option two, you've probably seen a lot of commercials on TV for Medicare Advantage plans. It's very similar to the structure that we've all been accustomed to, whether you're on an individual plan or a group plan now. It's an insurance plan that's private. It has co-insurance, deductible, co-pays, networks. It's exactly what we're used to throughout our lives. That replaces original Medicare, and you live by the rules of the structure of the Medicare Advantage plan if you go for option two. Now let's look at the setup. After you've enrolled in Part A and B online, you'll be waiting for this card, what's known as the red, white, and blue card. On it will be your name, your Medicare number, your Part A and Part B, or just Part A if you're still working, effective date, and that card is what's called your original Medicare card. Now, what do we decide to do after we get the card? Well, now's the time where you call, hopefully, an independent agent like myself, and you discuss the situation, what you're looking for, whether you'd like to purchase a supplement and a prescription drug plan or a Medicare Advantage plan, which is also known as Part C. So now we've covered A, B, C, and D. If you purchase a Medicare Advantage plan or enroll in a Medicare Advantage plan, because most of them have no premium, Part D is embedded in the plan. So you don't have to buy a separate prescription drug plan. You're also offered dental, vision, and some other benefits included in Medicare Advantage plan. So those are the two options that you'll have to decide on when you enter Medicare. Okay, let's talk about some of the positives and negatives of both structures. We'll start with the original Medicare. All right, if you keep a Medicare original and that becomes your primary, you can basically go to any provider in the country that accepts Medicare. There is no network. You could also determine the exact amount of coverage you need. You've probably heard of G plans or N plans. They're structured differently based on the coverage that they offer. But a G plan is the same throughout the country, and an N plan is the same throughout the country. The only differences are the price that you'll pay based on whatever is offered from that issuer. There's very little managed care and prior authorizations in original Medicare, and you can pick your own standalone drug plan, match it up to your medications. In other words, if you choose one carrier for your supplement, you can choose a separate carrier for your prescription drug plan if that formulary matches up with the drugs that you potentially are on. What are the negatives of original Medicare and a supplement? The negatives are you'll be paying 3 premiums. You'll be paying your Part B premium, $185 or more. You'll pay for the supplement that you purchase, a G plan and N plan, for instance, and you'll also be paying a premium for your prescription drug plan. So you'll have 3 premiums in this structure. You also will not have dental, vision, or other extras. So you need to buy separate plans for dental and vision. And you can have issues with your annual physical. Believe it or not, original Medicare does not look at an annual physical as part of original Medicare. They look at it as a wellness visit. So if you breathe into the mirror and there's fog, that's good enough for original Medicare. Okay? So your doctor might have to figure out a way to code the physical as a diagnostic physical in order for the tests to be agreed on by Medicare and your supplement. It's a very, very interesting nuance that most people don't realize. Original Medicare does not look at an annual physical as part of original Medicare. Okay, let's look at the positives of a Medicare Advantage structure. You generally only pay for Part B. Most plans are 0 premium plans. The Part D prescription drug plan is included, and it's as good, if not better, sometimes than a standalone prescription drug plan. Full annual physical is covered as part of the plan, and you also get extra benefits in the Medicare Advantage plan, such as dental, vision, and OTC. What are some of the negatives of a Medicare Advantage plan? Well, there's a network. So it's very important to check your providers and match them up with a plan, even if it's a PPO, because on a PPO, you'll still have access to doctors that are out of network, but you'll pay more coinsurance sometimes, and more copays. There's managed care and prior authorizations included in a managed Advantage plan. Obviously, in the news lately, prior authorizations are hopefully going to be changing soon. And they're working on that, but that's part of the structure. And the drug plan is usually solid, but you can't adjust it. In other words, if you pick a carrier for Medicare Advantage plan, That's the carrier that you'll have for your prescription drug plan. Okay, now option one versus option two. Some of the questions you might ask are, well, I use a lot of Medicare coverage throughout the year. Maybe option one is better for you. Or I have a number of doctors in different states. Perhaps option one is better for you since you don't want a network. You may say, I use average to low medical needs. Option two may be appropriate for you. Or if you have a high importance on dental, vision, and extra benefits, option two might be for you as well. We also need to consider something very important, which is called guaranteed issue states. There are four: New York, Connecticut, Maine, and Massachusetts. Those are called guaranteed issue states. What does that mean? That means if you go on a Medicare Advantage plan, and let's say 4 years down the road, you'd like to switch to a supplement. In those four aforementioned states, it's automatic. There's no underwriting, even if you are not healthy. Outside of those four states, it's called subject to underwriting, which means that if you're not healthy, you might not be able to purchase a supplement or your premium will be significantly higher. So that's a very important point when deciding about Medicare Advantage versus supplement. Now, once you pick a plan as you start in Medicare, you're not stuck. Every year during annual enrollment period, and a good independent agent will be reaching out to you, from October 15th to December 7th, you have the ability to make a change. That's when you see all the commercials on TV. That change starts effect for January 1st. So you have those 3 months to make a change. You also have open enrollment period. That's if you're on a Medicare Advantage plan only, you can switch to a different Medicare Advantage plan, or you can switch back to original Medicare supplement and a prescription drug plan. You have a trial rate. In your first year when you enter Medicare, you have a trial rate where the first 12 months, if you're not happy with the Advantage plan, you can move to a supplement, no underwriting. And if you're on a supplement, you can move to an Advantage plan. You don't need a special enrollment period during your first 12 months called trial rate. We also have special election periods. Let's say you lose your employer coverage, like we talked about, a delayed Part B. Since you're outside of your initial enrollment period, that application goes in as a special enrollment period. Let's say you move from New York, say, to Florida. When you move to a new state, you also have an opportunity to move to a different structure, or you will be changing to an Advantage plan in your locale. It's a lot of information, but every year, an independent agent like myself will follow up with you. We'll go over your plan, go over your meds, go over your doctors, see if the plan you're on makes sense for you. And if not, we switch. And if you are interested in switching structures, we also discuss that every single year. The next steps in general, whether it's with me or someone else, set up a meeting or a call, review your specific situation, go over your drugs, the pharmacy you use, the medications, obviously, that you take, all of your doctors, your hospital. Go over your past history in terms of how often you were in the hospital, how many doctors you see. That's going to help you decide, and your agent, which structure you should go in. And then if you're going on an Advantage plan, it will help that agent find the proper plan for you, for your specific bespoke needs. Everyone is different and needs to be looked at individual. That is your 101 of Medicare. I love Q&A. I think it's the most important part of these seminar and webinars, and I'm going to open it up for questions. And Gloria, I'm going to pass the baton to you.
Okay, great. Well, thank you, Jonathan, for that good baseline of understanding around the policies. So we'll start with the questions that were submitted via our registration form. The first one comes out of Sandy Springs, Georgia. How do you negotiate a lower premium when AGI has declined substantially since the 2-year benchmark?
Yes, so we talked about that. We touched on that. So basically, you file a form. It's called appealing the IRMA. and I could provide a link for that. And you will generally upload your new tax return or a document that shows that you have reduced income, and they'll adjust the IRMA accordingly. There's no negotiation per se. It's just providing the proper information for the government Social Security office to reduce that.
Great. Okay, our next question is from Oberlin, Ohio. What are the pros and cons of original Medicare versus Medicare Advantage plans?
Like, so I think we covered a lot of that. Just in general, I think, the pros for original Medicare is that there's no network. And there's no prior authorizations. It's not managed care. The pros for an Advantage plan, although there's a cost there, so that's the negative. The pros for an Advantage plan are there's no premium, and you do have included in that dental, vision, prescription drug plan. And generally speaking, the networks are large, but you do have a gated network to deal with. Those are sort of, I would say, the pros of both.
All right, moving on to the next one. This comes from Catonsville, Maryland. Under Plan D, is it necessary to shop around for best drug prices every time a new drug is ordered?
Great question. We sort of covered that as well. You can't change your Plan D at any time. You have certain periods of the year, like we talked about, to change AEP, OEP, as we talked about. I don't advise. It's a tricky question because when you go into a plan, your drugs are there at that point in time. We can't forecast what's going to happen a year ahead. Hopefully, the plan you chose has the prescription drugs on formulary. If they don't, you can also look for a formulary exception on the plan. So there's ways to work with the plan. I do want to mention with the Inflation Reduction Act that as long as you are on formulary, the maximum you'll pay on prescription drug plans today is $2,000. So that's the maximum out of pocket you'll pay on a prescription drug plan for formulary drugs.
And that's per person, right? So a couple would pay 4,000.
Medicare is always per person, just so you know.
Okay.
You're married, but you're divorced when you go into Medicare. Medicare is an individual situation, if you will, and so each one of you are separate. And actually, Lori, it's a great question. One person could be on a supplement, and another could actually be on an Advantage plan. You're completely separate when you go into Medicare on your decision making and your structures.
Oh, great. Okay, next question comes from Atlanta, Georgia. Still working until age 67. Should I go ahead and sign up for Part A now? Just turned 65.
Yep, we covered that as well. Yes, you should absolutely enroll in Part A. Like I mentioned, if you've been working 40 quarters, it's free. And it's always a positive to get your Part A set when you enter Medicare. And then eventually, when you retire, you'll be enrolling in a delayed Part B. That process is a little tricky. You'll have to get an employment verification form, which we provide to show the government that you've had credible coverage through the time that you were eligible for Medicare, and then you'll have no penalty. But yes, the answer is enroll in Part A when you enter Medicare.
All right, next question comes from some beautiful location in France. So international, live abroad, how does it work?
Oh, well, first off, I would love to come to France and have a meeting with you to discuss how it works. But most importantly, it's a tricky question. The reason why I say it's tricky is you don't have to have Part B if you live abroad. Okay. If you try to come back and get Part B, it could be tricky and you could be penalized. If you are planning on spending time in America, I still suggest having Part B. You don't have to have it, but if you're living abroad and you're going to be making many trips to America, it's good to have the B coverage and have Medicare as part of your arsenal, if you will. But if you do leave and you decide not to and you want to come back, you will be reapplying for Part A and B.
Okay, this next one is from Alpharetta, Georgia. When is it better to stay on my spouse's insurance versus switching to Medicare?
Another tricky question, in the sense that that's an economic discussion. So if you're on a group of greater than 20, and you're on your spouse's plan, candidly, like I said, you have a right not to be on Part B. You're effectively not enrolling in Part B. However, the way I look at this is if you're contributing to the plan, if you're paying an enormous amount of the premium, then it's worth looking at Medicare and analyzing the cost of Part B plus your supplement or Part B plus your Medicare Advantage plan versus your group plan and make a decision that way. Well, we also look at the summary of benefits on both. And if the summary of benefits is not as strong on the group plan as you may ignore in Medicare, then it might be worth going off the plan. But that's a personal decision and it's based on economics.
Okay, this one is from Decatur, Georgia. Working full-time at 70 years old with inexpensive employer insurance, $75 a month. How to transition to Part B/Gap?
Again, with that question, if the group is greater than 20, there's no need to transition to Part B and Gap at this point. For $75, if it's a decent plan, especially, no need, and you don't have to. But you can look at the plan and analyze the summary of benefits at that point. But if you're in the group and it's greater than 20, you can stay on that $75 a month plan until you retire or your spouse.
This next question comes from Manhasset, New York. If you are 70-ish and haven't joined Part B yet, what are the pitfalls?
Well, there's no pitfalls if you're 70-ish and you're on a group plan greater than 20 employees, you or your spouse. There are issues if you're 70 and you didn't enroll in Part B when you were supposed to. The pitfall is that you'll have a penalty. So it's really, like I said, it's based on rules based. And if you're part of a group plan, you or your spouse, it's 20 or greater, there's no issue with enrolling in Part B until one of you is off the group plan, and then you're a delayed Part B.
Okay, so now I see there are several questions in the chat, Jonathan,
Okay,
so I'm going to shift to those.
sure.
First question, are there exceptions to age 65 enrollment for people enrolled in a qualified employer health plan at age 65?
Again, it's based on the rule of 20 and having group coverage. That's the rule. So regardless of the structure that you have, as long as the company is greater than 20 employees, you or your spouse, and you're on that particular plan, then you can delay your Part B.
Next question, when do people who are currently employed enroll, before or after retirement?
Can you repeat that again, Gloria?
When do people who are currently employed enroll, before or after retirement?
Well, if you're currently employed and the company is greater than 20 employees, then you don't enroll in Part B until you retire and you're off the group plan. These are all sort of the same. I'm starting to get the sense of these same questions. And I want to really try to keep this simple. Again, we'll repeat it. If you or your spouse is working and the company that you're working for is 20 or greater employees, then you can delay Part B. If you're contributing a lot to your plan, then you have an economic decision. It's your choice if you want to enroll in Medicare, but you don't have to. You have a valid waiver.
Okay.
Okay.
Okay, next question. For individuals not working with an independent agent, what resources do you recommend for comparing Part D prescription drug plans based on current medications and needs?
You certainly can go on Medicare.gov, and they'll have a tool for you to look at the various prescription drug plans in your location. You'll be able to put your prescription drugs in, and you'll be able to compare plans accordingly.
Okay. Okay, to confirm, you are suggesting registering for Part A at age 65, even if we work for a company with more than 20 employees and we have insurance through them.
Confirmed. Yes.
So you have to register at age
You don't have
65
to, you don't have to, but
for
it's my
Part A?
recommendation to enroll in Part A because, as I said, it's free for most people. You're eligible for it. It doesn't cost you anything, and it's always great to have Part A in place prior to whenever you retire, and then you're just going to be doing a delayed Part B. So I strongly recommend enrolling in Part A when you're eligible for Medicare.
All right. I registered for A when I turned 65, but I
You
am
listened to me.
working.
Good. Great.
But I'm working and meet the requirements to delay until I retire. I did not register for Part D. I assumed I only had to register for A and that I would register for D when I registered for B. Am I
Yes.
correct?
Yes, it's an amazing question. As long as you can prove that you had credible coverage for your prescription drug plan, then you're absolutely correct. You will be enrolling in Part D as a standalone with your supplement, or you'll get Part D if you enroll in a Medicare Advantage plan embedded in the Medicare Advantage plan. So you're correct in your assessment. You do not have to enroll in Part D if you're only enrolling in Part A, but you ostensibly have credible coverage through your group plan. But it's very important, and I use the word credible coverage because it must be credible coverage for your prescription drug plan to pass muster for you to not have a penalty for Part D.
Okay. All right, next question. Can I purchase a Medigap plan before I actually turn 65 during that 3 months prior?
You can't purchase a Medigap plan or a Medicare Advantage plan until you have your Part B effective. Now, um, can you put an application in for that? Yes, but there will be an MBI number needed to be attached to that application. So I strongly recommend waiting for the MBI number, but an application potentially could go in without an MBI number. Yes.
Okay. Okay, at 65, I was still working and did not enroll in Medicare A. I am on Cobra now. It will still apply until end of 2025. When can I switch to Medicare?
Repeat that because how is the person over 65 now? I'm not sure the question in terms of age wise.
It doesn't say, it says at 65, I was still working and did not enroll in Medicare A. I'm on Cobra now. It will still apply until end of 2025.
No, so Cobra is not a valid waiver for Part B. So if you're on Part A and you've left your group plan, then you need to enroll in Part B. Cobra will not be an effective waiver for your Part B. So you need to enroll in Part B ASAP.
Okay.
Yes.
And this person's not enrolled in Part A either, so probably same.
Yes.
Yeah. A and B.
But
Okay.
Cobra is not a valid waiver for Part B. We talked about that in the presentation. A lot of people don't realize that, but it is not. And so once you leave your group plan, you'll have that short time period to enroll in Part B.
Okay. Let's see. And here, I think this is a general comment, maybe not a question, but your retirement date is treated like your birthday. Same 7 month period applies.
Well, no, you don't have a 7 month initial enrollment period window when you retire. You'll basically have an effective few months after you retire to enroll in your Part B. So the 7 month window is only for your initial enrollment period around your 65th birthday. After that, the rules change for a delayed Part B in terms of your time frame to enroll, leaving group coverage.
Okay. This is a comment. Found many Advantage plans don't cover elder care thoroughly. When bad things happen, no coverage for assistance.
Is that a comment or a
I think
question?
it's a comment,
Okay.
maybe asking.
Uh, I'm not exactly sure the coverage for the elder care that this person's specifically asking. It might be better served for a one-on-one discussion. I think from a general perspective, I need more information to answer that. Yeah,
Right. That's kind of one of those more personal
yes,
one-on-one conversations that you might want to have.
yes.
And similarly with sharing just a specific instance about a family member who had an issue. Okay. Wait. You have to start the process 3 to 6 months ahead of your retirement date for Social Security. I found that I had to get in gear with SSA and Part B in order to get started setting up my additional medical insurance.
Sorry, Gloria, can you repeat that one?
Yeah, you have to start the process 3 to 6 months ahead of your retirement date for Social Security. I found that I had to get in gear with Social Security and Part B in order to get started setting up my additional medical insurance.
Uh, y- yeah, I mean that's yes, you need to prepare 3 to 6 months prior to enrolling in Medicare. Social Security is a completely different topic.
Yeah, but you can't have, I'm sorry, and it was my question, so I have to jump in here
Sure.
because of what I found is you can't have one without the other. Unless you got started with the B, the rest of the medical insurance, whether it be Advantage or one of the supplemental plans, they didn't want to talk to you until all both of those things were locked in. Maybe, and I thought maybe it was because they wanted to be able to do the deductions and tie them in or whatever, but I didn't care. All I knew was Social Security needed 3 to 6 months in order to kick in my time frame, and that the medical insurance companies that I talked to for the different sorts of plans, the G's and the whatevers, seemed to want to know that B was going to be kicking in before they would entertain my queries.
Yeah, so Dawn, we'll talk about that after. You absolutely are correct. Part B, you have to be effective in order to purchase a supplement or a Medicare Advantage plan.
Okay.
Has is a completely different topic with Social Security, though, has nothing to do with Social Security. But you are correct. In order for you to purchase a Medicare Advantage plan or a Medicare supplement, you must have Part B effective. Correct.
Okay,
Yes.
thank you. And
Yes.
you can only do that through Social Security, which is why it just seems like they're inevitably tied together in that magical way that only like brainiacs can know about. Anyway, so
Yep.
thank you.
No
Yes.
problem. No problem whatsoever. Yes, exactly.
And here's a comment. Thought there was a penalty if you don't register for A.
No, there's no penalty for A. Well, the penalty, like we talked about, was the 1% penalty. However, the penalty is really if you haven't worked for 10 years, then you'll be paying for Part A. Part A is free as long as you've worked 40 quarters throughout your life or your spouse, it's free. There's no such thing as penalty because it's free. There's no premium attached to A. Again, as long as one of you have worked ostensibly for 10 years, which the majority of people I would imagine on this call have had 10 years of work throughout their life or their spouse. So that Part A is generally going to be free for most people with no
Okay.
penalty.
Next question slash comment. I am 67 and covered on a qualified employer plan. I did not have the benefit of your advice when I was 65, so I did not enroll in Part A. What do I do now other than go to SSA website and enroll in Part A now?
That you should enroll in Part A now. And I'm assuming this person's also retired and wants to enroll in Part B. I'm not sure exactly the status of this individual, but you should enroll in Part A. Like I said, Part A, you can enroll at any time. It's always good, like I said, to enroll during your IEP, and then you get it out of the way. If you've worked, Part A will be free.
Okay, yeah, this person looks like they're still covered on a qualified employer plan.
Yeah, then you could enroll in Part A.
Okay. And then Dawn also added in a few clarifying points, which I think she shared
Great.
in conversation. Thank you, Dawn.
Yep.
Okay, here's a question. Do independent agents such as yourself charge a fee to review the Gap and Advantage plans, or do you get compensated when we purchase one of those plans?
Correct. There's no fee for our service. We get paid by either the Medicare Advantage plan or the supplement company that we choose. There's no fee at all. And the price will be the same whether you use an agent or not. So it's, in a sense, a service that we provide for you entering Medicare. And then more importantly, I think, is following you every year. Things change, and 65, you're very different at 80. And I think that it's important to have someone by your side analyzing each year your plan, your current situation, the changes, the rules and regulations in Medicare change. I wouldn't be surprised if there's more states that have guaranteed issue down the road. There's talk about more states expanding guaranteed issue for supplements. So all these rules, I think, are important to have someone who's up on them as you go forward, and there's no fee.
And this so far is the last question. Are you supposed to review your income annually to determine if your Medicare premium will change?
You don't have to review it, they do it for you. Um, the government has a great way of looking at your tax returns and aligning your tax return, your adjusted gross income, with your Medicare premium for Part B and D. So if your income goes up, your IRMA will go up. If your income goes down, your IRMA will go down. So it's a scale either way, but you really don't have to do anything. You have to file your tax return, but they'll keep track of that, and as your income goes down, they'll adjust your IRMA accordingly.
Okay. A couple more questions popped in. This one clarification is the gentleman who had the COBRA question earlier. I'm 66 on COBRA. If I enroll in Part A and B now, will they interfere with COBRA?
If you are on COBRA, you're effectively you if you're on COBRA, that's not a delayed Part B. You need to enroll in Part A and B now. You can't have COBRA coverage and be eligible for Medicare. Okay, so if you're over 65 and you're on COBRA, you're effectively not following the rules, and so you need to get off COBRA and you need to enroll in Part A and B, because remember the rule is if you're currently working and on group coverage. If you're on COBRA, that means you're on group coverage but not working. And so therefore you don't meet the rule of working and on group coverage. So COBRA is not a valid waiver. You must enroll in A and B.
Okay, this question, if someone is over 65 and hasn't applied for Part A, do you have to wait till the open enrollment period to apply?
Nope, you do not. You can enroll in Part A. Open enrollment period is only for enrolling in Medicare Advantage plans and supplement, the gap piece. A and B are the rules that we talked about with respect to initial enrollment period or delayed Part B, but there's no period to enroll in Part A, if you will. Has nothing to do with periods.
All right, that's all the questions we had, Jonathan.
Right.
So is there anything based on what you've heard that you really want to emphasize for our group?
Yeah, look, I think Medicare is a very confusing topic for everyone. And I have clients throughout the country that I work with. The rules are very different in different states. I think going through this alone is just a very scary proposition. So my strongest advice, and again, whether it's me or someone else, I strongly advise working with someone who's professional, who does this daily, who knows the rules, who understands how to ask the right questions and structure the proper plan for you. That's my strongest advice. Like I said, you don't pay for the service, and it's a wonderful service to have as you go forward into this new journey of Medicare.
Great. There's some nice just thank yous happening in the chat.
Oh, you're very welcome.
Yes, this is recorded, so we will send this out. And I'm actually going to share my screen real quickly. I'm hoping you see this with the QR code. This is goes directly to Jonathan. If you would like to scan this, we'll send you links and all of that. But if you're at your computer with your phone, sometimes that's an easy way to get that on your to-do list. But just I agree, Jonathan. It's so complicated.
Yeah. I created this. I didn't create this card. By the way, when you open this this wonderful code, I did not create this card, but I had a little help. This is a great digital card because it has all my contact information. It has my reviews from many clients that you can read about. Like I said, it's very important to work with someone who others speak about, and I tend to think that when others speak about someone, it's the best way to evaluate. So enjoy this digital card, if you will, and feel free to reach out to me, email. I also have a calendar that you can set a direct meeting up with me. But at any time you'd like to speak, I'm here to have a one-on-one conversation.
Thank you. And it's so wonderful to have an Emory alum, a fellow alum, to help guide through this very complex process. So I'm also, as we wrap up today, I wanted to share just a few upcoming programs that we have. for the Global 60 Plus Network. Coming up in July on the 23rd, we have Internet Safety, Banking, Shopping, and Scams, Oh My. David Schweidel was one of our wonderful Emory professors, really a renowned expert in this area. So I highly encourage you to join us for that. It'll be Wednesday the 23rd from 5 to 6. We do try to have our webinars on Wednesdays from 5 to 6. It just works well with our group usually. So keep an eye out for that and know that Wednesdays are a good day for us. So I'll send this out to you so you can register easily. We also are having an in-person event up at the Highlands in the Highlands, North Carolina, Mountain Melodies. We will have an afternoon tea from 2 to 4 with Paul McClarty, one of our alumni, wonderful alumni who lives up there at his beautiful home. And then we'll head to the Performing Arts Center for the concert. There's no charge for the tea, and we actually are giving a 50% discount on the Highlands tickets. So you may want to check it out if you're interested in that concert. Then this is a fun in-person event also happening on Tuesday, August 12th. This is a brunch and learn. This is where you can just learn, come and have a mimosa and a little food and some friendship and fellowship and learn about other ways you can be involved with Emory. It's just a great time to connect with other alumni and staff here at the Miller Ward Alumni House. And then a few other things coming up, on Wednesday the 27th, we have another webinar, and that'll be with Gary Hawk, our wonderful, now retired university historian. And he'll talk about Coca-Cola's impact on Atlanta and Emory. We are going to go in September through Oakland Cemetery, do a little scavenger hunt and tour with some of our alums who are docents out there. That'll probably be a morning or mid-morning program just for the heat. And then we may have lunch afterwards, more to come on that. And then Thursday the 18th, we're going to travel out to Oxford College and the Oxford campus and go to the Emory Ideas Festival. And the Divorce Homecoming will be happening on October 25th. So lots of fun things happening and coming up for our Global 60 Plus Network. And we hope you can join us. And again, I encourage y'all to give Jonathan a call just to help work through this maze of Medicare. So thank you again, Jonathan. We really appreciate your time.
Thank you, Lori, and thank you all for attending. And I hope it was a wonderful Wednesday. I know it was no class Wednesday, but I hope that you learned a little bit. I imparted some wisdom, and I'm always here to answer any questions as we go forward.
Great to see you. Thank you.
Thank you
Thanks
too,
so
Larry.
much.
Thanks, everyone.
Thank you, everybody.
Thank you.